All right, Raymond, you're live.
All righty. I'd like to go ahead and call the Respiratory Care Advisory Committee meeting to order on February 8th, 2021. At this time, I'd like for everyone of the committee to introduce themselves, and I'll start off. My name is Raymond Peasany. I am the chairman for the committee.
Diana Mirandino, secretary.
Kenneth Alexander, committee member.
Brett Stafford, committee member.
Sheila Guidry, committee member.
Michael Nolan.
Ms. Hamilton, if you're there, if you can unmute yourself.
Michael Nolan. Can you hear me?
Yes,
Yes,
we
sir,
can.
we can.
Beth said she's not able to unmute. I'm reading messages from her now.
I'll let it go to the bottom left of her screen. There's a little mic button that's got an X across it. And click it and it'll unmute.
Okay.
Jacinta can also, whoever's managing as host can also, Jacinta can unmute her as well.
While we're waiting for Ms. Hamilton to unmute herself, can we have the rest of the guests in attendance introduce themselves, please?
Shannon Cyprian, licensing analyst.
Jacinta Dutu, executive staff officer.
I'm Vincent Collada, executive director of the Board of Medical Examiners.
Beth, it looks like you're unmuted.
Paula, are you on the meeting? Ms. Phyllis, would you introduce yourself, please? Unmute yourself and introduce yourself. Please unmute yourself, Ms. Phyllis, and introduce yourself.
Can you hear me now?
Yes,
Yes.
sir. Yes, ma'am.
Okay, my name is Phyllis Johnson. I'm a licensing analyst supervisor.
Paula Pigford, LSBME Investigations.
We'll go ahead and move on with the meeting. And if Ms. Hamilton comes on, we'll have her introduce herself at that time. Next, we'll open the meeting to any public comments. Jacinta, is there any?
There's none at this time.
Okay, we'll move to item number 3, approval of the minutes from our meetings of December 7th. Should we do those individual, Doctor, or one at a time, or all together?
I think you can do them all together.
Okay. Approval of the minutes from December 7th, 2020, December 16th, 2020, and December 28th, 2020. Do I have a motion to accept the minutes as presented?
A motion to accept.
Do we have a second?
Second.
A second for Brett. Any discussion? All in favor?
Aye.
Jacinta, Dr. Vanderton or Jacinta, does this take, since it's on Zoom, is this a roll call vote or is an acclamation accepted?
No, just if there's no objection, you can accept it by acclamation.
Okay, that's what I thought. Thank you.
Any opposed? Okay, minutes are approved as presented. Item number 4, old business, follow up on the revisions of the RT rules and regulations. Dr. Van.
Well, unfortunately, there have been a lot of rules that had to be done ahead of you. I apologize that we couldn't get them all done, but we are back. We're about to finish 8 rules for the board in other areas, and then we'll be coming up to you all with your rules to go to the board for approval, and then through the process. But again, I apologize. It just got lost, and it got bumped down the queue. It wasn't lost. It was just bumped down the queue.
Thank you, sir. CE Broker.
This is the weekly report as of January 15th. You have, I think, over 400 people who have signed on, established an account. The vast majority of them are establishing the basic accounts. About 30 of them have paid accounts, but you do not have to have a paid account to continue to do this. And we just keep watching it. And it's going to be interesting. You need to continue to share with your constituencies the fact that they need to sign up and get on board.
All righty. Is there any other old business that anybody would like to bring up at this time? All right, we'll move on to new business. Licensing supervisor report, Phyllis Johnson. Phyllis, is there anything to present to the committee?
No, there's nothing to report.
Thank you. License analyst report, Shannon Cyprier.
There was a question in reference to IV distribution. I think the email doing vitamin infusions via IV. She wanted to know if she.
Was that from Ms. Ponville?
Yes.
Yeah, that'll be a little later in the agenda.
Oh, okay. Well, no, nothing to report.
Thank you, ma'am.
You're welcome.
COVID pandemic status, relicensure. Any updates for us, Dr. Collada?
At this point in time, no. We don't seem to be having any problems. If you all are aware of any, let us know. We continue to tell, and we would share with you all to continue to advise your constituencies, especially those that are finishing school, establish their portal, get their work in, get their application in so that we can grant them a provisional permit pending the completion of the test. We know the test may be harder to take this year than perhaps 2019, but certainly more available than 2020. And the sooner they get the test, the sooner we can permanently license them and get them moving.
All righty. Next, we'll move on to correspondence regarding scope of practice question from Callie Johnson. And that was in your packet that you received previously, and that was pages 5 through 17. Did everybody have a chance to review that letter and all the documentation provided?
Yes, sir.
Yes, sir.
Yes.
All right, is there any discussion on it?
Raymond, my question is, this is a girl from Hertz, Texas, who is speaking out for the RT community. I'm just asking, the first time this came about, we wondered if it was a business proposition. Of course, I looked her name up. I can't find anything regarding to a business. We do have the ability to put in an IV line. We do for fluid only. When we've discussed this in the past, we discussed it on looking at those that were possibly in long-term acute settings that needed IV access to, say, continue their 6-week regimen of antibiotics, and they were being delayed. I'm just curious as to her purpose behind this.
Yes.
Yes, I am too.
I agree. This is Ken. Let me get off. Let me put some video on for you. Yeah, and looking at this, a couple of things. I'll try to be succinct and others a turn. One, out of the clear blue, somebody from Texas is advocating for Louisiana. So I'm a little skeptical that there's not some sort of underlying business business purpose for this, given her employer, what she does, if she's working for a company, that this would be advantageous for them. Not that that's a bad thing, but so it just rings a little off. But more importantly, and actually more to the point, is, has anything changed? And this is kind of a common question, Raymond. And Dr. Van, has anything changed since we put out an opinion in 2017 that was listed out in the documentation about putting in PICC lines, putting in vascular access for something other than a respiratory therapy specific need and procedure? Has there been any change, and is there any change in practice pattern in AARC guidance and any of those things, or NBRC guidance, that would make us change our decision from what we did in 2017? Does that make sense?
Well, I can answer that by saying we did have that request that I sent to Raymond from the licensing the board rather, and the board was concerned about how this is evolving. I would guess is the best way to say it. At this time, this board, the Louisiana Board of Medical Examiners, has not changed anything, but looks to you all to see and suggest if there are anything that needs to be changed. I mean, as long as we're doing things that are not related to therapy outside of the world of respiratory therapy, I don't think there's going to be a problem. This seems to transcend what we have traditionally done, and you guys can either say yes, and it would still have to go to the big board for final approval. The advisory committee can say no, and I would still send it to the big board for approval of your recommendation, ratification of a no answer. But I think you're moving out of respiratory therapy into nutrition therapy, and I'm not sure that's someplace that you all want to go, but it's your decision to make a recommendation.
All right, now the nutrition therapy, and Dr. Collada, the next one coming up has to do with an infusion of vitamins, which that in my mind is no. But on this one, I'm not sure, again, if they're referring to, well, I mean, she's referring to venous access regardless. She even went so far as to say, put in central venous catheters. The last time we talked about it, it was PICC lines. Mm-hmm. And again, I guess if Shreveport right now was saying we don't have the manpower and patients are being delayed on getting their continuous infusions because we're having to wait hours upon hours for physician or whoever to come in and put these in, then I would be more than willing to discuss. But for somebody to come in from Texas to say, this is what y'all need to do, I'm not necessarily for this at this point in time. And being up here in the education piece of it, usually if the hospitals are looking at delving into new areas, they either refer back to me as somebody who sits on this board for an opinion, or they refer back to the schools about, would y'all be willing to add this to your education process? And I'm not hearing any of that from North Louisiana.
And Dinah, this would be a question for me too. Is there an industry need in the state of Louisiana right now? Granted, RTs have the technical skill set to be able to put in peripherals. Central lines, that's getting a different area for me. But I'm not at the clinical front lines. I surround it, but I'm not in it. So I can, I'd love to hear other opinions and opposing opinions. But for me, it's about if one, the access, the ability to create a vascular access is already granted RTs as part of their generalized scope of practice, right? If it's RT related, knowing that in crisis standards of care, that a facility can broaden liability protections and procedural protections or allowances for those crisis standards. But then you still got the individual practitioner that has to live within the scope of their license. So you have that to manage against. But if it relates to RT, not an issue. If it's to facilitate access to make somebody else's life easier, or for staffing patterns, or for whatever those are in certain business purposes, that's not the intent, I don't think, of the procedural access, and not to limit an RT to do anything that's available and allowed, but we have a scope of practice that we have to protect, I think, and not to create undue liability for the practitioner, the facility, or ultimately the board, if the board allows a broader access outside of what is a legally scoped scope of practice, or a legally defined scope of practice, if that makes sense.
Yeah, at present, I haven't heard anyone around the state and, asking that they be able to do this anything else besides what we have already put forth in rules and approved at committee meetings. So again, she's from out of state. It does strike me, there's a bit of concern of, what's behind this or whatever. And, I'm comfortable doing what we're doing right now, what we put in place with the PICC lines and arterial lines and all what we're doing right now.
I support that.
Brett, you're the other clinical person out there. Has anything changed in your facility?
No, not currently. Everything's the same as it's been.
Okay, any future plans?
Not that I know of.
Okay. All right, so we just keep on keeping on with what we're doing.
Mr. Chairman, is there a vote required for this, or just that's our opinion?
That's what I'm getting ready to ask Dr. Collada. How do we handle this, Doctor? Do we have to?
You should say that the advisory committee recommends against this at this time, or for this at this time, and then I will proceed on based upon what you decide.
Okay, is there a motion on the floor to how we proceed with Ms. Johnson's request?
I would make a motion, Diana, for the record, that this young lady, what's her name? Whatever her name is.
Callie Johnson.
Allie Johnson, that her request was considered, duly noted, but at this time, the Respiratory Care Advisory Committee feels that the current allowance of vascular access is sufficient for the needs of the patients in the state of Louisiana, and changes are not necessary or warranted at this time.
Okay.
Is there a second?
Second.
Second.
Okay, I have a second from Sheila. Is there any further discussion? All in favor?
Aye.
Aye.
Any opposed? Motion carries. All righty, we'll move on to correspondence regarding scope of practice questions. Shelley Pondville, pages 16 and 17 in your packet. Here we have a request that we have a licensed therapist requesting if she can provide vitamin infusions. And she would like some feedback on starting IVs and administering vitamin infusions. Is it within her scope, within the respiratory scope of practice?
Okay, so here's my question for this one. All right, so she's working as a licensed respiratory therapist, but then says, I have a part-time job at an aesthetics clinic in Metairie. Is she working as an RT in this Metairie clinic? Or is she somebody else that's been consulted in? I'm trying to figure out how the RT fits in the aesthetic clinic. As an RT, my comment would be, no, you cannot infuse vitamins. We said you could start an IV if there was a need for fluid administration, and this was really for the EDs in emergency situations where somebody else could not get to it. And I think she's trying to bring her RT practice into an aesthetic clinic.
Do you feel
I
you
would
need more
agree.
information to make a decision?
Well, my
Well,
opinion, Dr. Colada, is I'm not sure about this infusion of vitamins. And again, we're allowed to hook up an IV bag with fluid if the physician or the nurse practitioner wants to take that bag of fluid off and then hook up their vitamin infusions. She didn't do that. She just put the line in with the fluid thing. But I don't think she ought to start the IV and connect it up to vitamins.
Well,
I don't
again,
think,
are you satisfied that you can render an opinion today based upon what is written in and not assumed to be written in that request?
For
Should
me,
we, Ken?
To Dr. Collada's point, my question would be, can you tell us how this practice is relevant to your practice of respiratory therapy within the context of this clinic? And so to get a little more, just to cover the base, at face value, it looks like an aesthetic clinic and somebody's trying to leverage a license to expand the capability and to meet the clinic's needs, not necessarily the patient's needs. So that's my gut, but there's some assumptive reasoning in that to Dr. Collada's point, if we want to cover the base and dot the I's, cross the T's, is ask her how is this relevant to the practice of respiratory therapy? One, for the procedural piece of it and also for the clinic piece of it.
Is there any other discussion?
If you make a motion to get information, Jacinta and I will send a letter from me on behalf of the committee asking whatever information you want, or to more clearly expand upon how this use is going to, how this is all going to take place. I mean, it's whatever you want to do, we'll get the answer for you.
Just listening to the committee members, I think there's probably a little bit more information we need. And to Ken's point, what is in her role as a respiratory therapist, procedurally and clinically, how is it relevant to the practice of respiratory care? So would someone like to introduce a motion for us to obtain more information?
I would like more information.
Okay,
I'll second that.
okay. Any further discussion? All in favor? Any opposed? All right, motion carries. So Dr. Collada, y'all will send the letter to Ms. Ponville?
Yes, and is there any specifics that you want included as a specific request from the committee? I'm happy to do that as well. Ken, otherwise just send me what you want the question to say, and I'll make sure it gets in there.
Okay, I'll send an email out to the group so they have a chance to see it as well.
Okay, thank you very much.
Yes,
Thank you,
sir.
Ken. All right, Next on our agenda, we have correspondence regarding a scope of practice question that was sent to me by the Louisiana Society for Respiratory Care and the American Association for Respiratory Care on respiratory therapists administering the COVID vaccines. I'll let Sheila speak a little bit of that since I received the email from her.
I received a request from the House of Delegates, which I'm a member of, the ARC, that we contact our contact person in our state for licensure, which would be, I felt would be Raymond, as to whether our state would consider allowing respiratory therapists to administer the COVID-19 vaccine. Since that request went out, there's been several states that have gone to their licensing boards or the governor, and they have started allowing them to administer the vaccine. So basically, I guess it's, you know, do we want to allow our therapists to do this in our state, which I feel would be, you know, something that therapists would be quite capable of doing, and aiding in the administration of the vaccines. Just not certain how we would go about getting permission for them to do that.
Are you talking about the independent or as part of a vaccination program in a hospital? Are we going to talk about them being able to get their own vaccinations and give them to people without the presence of nurses, doctors, or anything else? How are you proposing to do this?
No, I don't think so. I think it would be, you know, in the presence of doctors, nurses, whatever, just as aiding them in helping to get administer these vaccines if the need would be to, you know, need extra help, either in their hospitals or probably I would think in their hospitals if that's where they work. In their hospitals are administering the vaccines.
Well, I would like to make sure that whatever you recommend is something that ultimately the board can approve. And I think that if you're recommending that it's part of a institutional program where they are part of a larger team, including physicians and nurses, I don't think the board's going to have any problems. But if this is the independent practice, like we've seen already in this country, people are taking this out and just giving it to people that they get it. I don't want to be involved. I don't think the board's going to go for that, but you can recommend it. I'll present it to them, but I think you ought to make it clear what you want them to do.
I have a thought I'd like to share. Can you hear me okay?
We can hear you, Mike.
Okay. I just took the vaccine second shot. They had a nursing assistant administer it. However, she's under the supervision of an RN. And so there is some monitoring going on, but I can tell you the nursing assistant did a great job. Yeah, but they are under the supervision of a registered nurse.
I can tell you here in Shreveport with the large rollout between LSU, Willis-Knighton, and Christus, they've been utilizing medical students, second-year medical students. They haven't gone out into practice, and they've utilized some of maybe the PA students also in that. So, and they have a tremendous need up here looking for, I think the last list I got, they were looking for 20 volunteers to work like 4-hour shifts. It's not an 8-hour stint. So you're looking at minimum of 40 people to run the operation they were running up here at the fairgrounds. So there is a need.
I can, my opinion, a comment, and I get Dr. Clotter to correct me if my memory's not hitting this on all cylinders. The governor's most recent proclamation allows for unlicensed personnel to administer vaccine. So to meet that need, there's an emergency rule that the nursing board put out that also says that a nurse can supervise unlicensed personnel. So nursing assistants or whoever in the administration of vaccine. So I think within the emergency, one, the emergency proclamation of the governor, two, if we are under the supervision of a physician and or a registered nurse in the provision of that vaccine, I think we're covered and fine.
I agree, but I just don't want to have this situation where people are doing it independently of that. And more importantly, I think you must remember that you all are a licensed person now, and is that part of your scope? And I think that we can do it in one of two ways. We can say that the administration of subcutaneous medications is something that's part of the scope. We can say that during the COVID crisis, the administration of intradermal vaccines is acceptable, or we can say it's part of your normal scope out in the future. But again, I think one of the things, if we go to an emergency concept, it doesn't have to be a real rule. But if you say to us that you want to change the scope of practice anytime after the COVID crisis is over, that would probably require a formal rule change. So understand, I want to do what you want to do and just advise you of the options of how you get to where you want to go. And I need to know, is it just for the emergency of the COVID crisis, or do you want them to be doing intradermal and subdermal injections of medications in the future?
Are these intradermal, Dr. Van, or are they IM?
They're IM. That's subdermal.
Okay, subdermal.
Discussion on how,
Go ahead, Raymond, sorry.
discussion on how we want to proceed with this.
I'd like to
I have
make
a
a motion
Okay, Mike?
under the physician orders that respiratory therapists be allowed to administer the COVID vaccine.
Hey,
Ken?
before somebody seconds that, Mike, the way you just voiced that, unless I'm wrong, which I'm easily wrong, is you just put it mandated under a physician's order and it's not required for the vaccine. So we wouldn't be able to do it. We wouldn't be able to do it unless a physician specifically ordered it under that direct motion.
Good catch, Ken.
All right, and I before we, well, I was going to say, so that motion needs to be redone, and I have another question, and I don't know if Sheila was going to ask this or not, but when we got into the swine flu, what year was that? 2009? 2009. And we wanted to assist in giving out those vaccinations. And there was a lot of nasal vaccinations, which we thought would be right up our alley since it was inhaled. That piece of it was denied. So the question is, not that I want to go out and give injections, and I am all for assisting during the emergency. We didn't get a governor's proclamation on the last one with an emergency. Do we just want to consider the COVID, or do we want to go back and look at it as a whole? Again, we weren't allowed to give the intranasal administrations that they were giving out in all the schools.
I'll piggyback on that, Diana, is it kind of comes to the old axiom, how do you eat an elephant? One bite at a time, take it step at a time. Right now, we're in a current PHE. So during the PHE, I got no issue at all.
Okay.
And if the board can write a rule or put in an emergency rule or do something, if that's necessary, specific to RTs being able to administer COVID vaccines, I'm all for it. whether, and I would defer to others or to Dr. Van or others, whether that would be under, and I'm making an assumption it would be under the supervision of a physician or an other appropriate licensed independent practitioner. Or RN, since the LSBN put that in for RNs. I don't know exactly how that would need to be structured. Bottom line is I got no issue during the PHE at all. And if you want to entertain it after the PHE, I think we've got time and the ability to do that. And you've got track record there.
There you go. Thank you. So Ken?
Okay, we have a motion on the floor by Michael.
Aye.
Michael? Are you still there, Mike? Okay, Mike has offered a motion on the floor. Diana, what was this? Did you write it down?
Under physician order, RT may be allowed to administer the COVID vaccination.
If it doesn't get a second, it dies.
That's fine.
It dies. Do we have a second? For lack of a second, the motion fails. Would anyone like to offer another motion?
I think just rephrase Mike's motion, and I can, if Mike wants to make it, I don't want to, whoever, to allow for, to ask the board to use the appropriate regulatory method to allow RTs to administer COVID-19 vaccines during the proclaimed or whatever the appropriate verbiage is, PHE, public health emergency timeframe.
Okay, we have a motion on the floor by Ken. Do we have a second?
I'm sorry,
second.
folks. I can't hear Ken's motion. Can you get a little closer to your speaker? All right.
Yeah, sure. Basically, I just changed yours, Mike, to say, hey, to use the board's regulatory authority to use whatever provision is available to them to allow RTs to administer vaccine during the COVID public health emergency.
Okay, thank you.
Okay, we have a motion on the floor. Do we have a second?
I second.
A second. Any discussion? All in favor?
Aye.
Any opposed? Motion carries. Is there any other new business that anybody'd like to discuss at this time?
I have something I'd like to bring up, Raymond.
Okay.
It's a continuing education item that just recently come up. In our section for our approval of program sponsors, the American Red Cross is not listed on there. However, the Red Cross now has an advanced life support class that they do. And actually our facility has changed over to it. Had one of my employees, when they were going in to see broker, of course, it's not an option because it's not one of our approved providers. However, in our subsection 2557, qualifying continual professional education programs, under B2, it states programs on advanced cardiac life support, pediatric life, advanced life support, or a neonatal advanced resuscitation program, or the successors, each of which will be equal to 5 contact hours. So I was bringing that one up because we do have a new provider that has an advanced life support class out there, but it's not one of our approved providers. So the staff aren't able to utilize contact hours for it. So didn't know if that would fall under, because it kind of covers under the B2 there, programs on advanced cardiac life support. But like I said, since it's from Red Cross and not the AHA, it doesn't fall under our approved provider list. So I don't know which one of those would take precedence.
Any discussion?
Well, my concern is, and again, I was unaware that the American Red Cross was going or is offering the advanced cardiac life support. the way CE Broker is set up, if you plug in Red Cross, my assumption, so Dr. Collada, if I'm wrong, please jump in, and I go out and take a lifeguard course to pull a drowning victim out, I can list that and check Red Cross and it's going to go through.
Well, yes, you are correct operationally, but because it's a rule issue, we either have to issue an emergency rule or we have to change the rule. And that's why, you know, as we evolve this rule, we'll have to come back to you and make sure we let you know that we're going to put that in as we start to draft this new rule in line with what we've done already. I think the key here is at the present time, we're not set up to, and by rule, to allow them to use this, okay? I think that we have to follow the rules in this regard. Now, if you think that this is critical enough, and again, I would have to trust you all to know, and I'd probably have to ask some cardiologists to know, is this an equivalent course to ACLS, or is this something that is Red Cross and not as good, but expeditious? I mean, I don't know. I don't know enough about it.
Now, I'm just speaking from opinion. I'm going to say it's equivalent because I would tell you our whole facility has switched over facility-wide and got away from AHA, ACLS to the Red Cross ALS.
Well,
I would suggest that we probably do a little bit more research and present back at the next meeting. Again, you know, I'm unfamiliar, you know, that the Red Cross was doing that. And of course, it could be another opportunity, you know, for whatever reason. But I think we need to do a little bit more research, in my opinion, and look at this and see if it warrants a rule change.
And the next question I had, because I have slept many, many nights, didn't we go back and say that the advanced cardiac life support would be initial if the new goes through and it would not be used for renewals? Or am I making that up, Raymond?
Yes, you're correct.
Okay.
And that would delineate that if it moved forward and was cut off of there. So
yeah,
wouldn't worry about it then.
We can look into it further and bring it back to the next committee meeting to discuss. And I'll circulate some emails out amongst everyone.
Sounds good.
Thank you, sir. Is there any other new business anybody would like to bring forth? Okay, item number 6, 2021 meeting dates. We have February 8th, which is today, May 10th, 2021, August 16th, 2021, December 6th, 2021. All meetings will be held via Zoom until further notice. Before we enter into executive session, is there any public comment out there that we need to address? Dr. Van or Jacinda?
I have none. Jacinta, you are aware of any?
I don't have any at this time.
Okay.
All right, at this, do we need to read anything before we go into executive session, Dr. Collada, with the new rules?
Okay, at this point, you would have to just simply move to go into executive session. Give Jacinta about 3 to 5 minutes to stop the broadcast, and then you can proceed on an executive session.
At this time, I would like to ask the committee that we move into a executive session.
Second.
Who motioned it first?
Motion.
Okay, Diana and Brett.
Second.
There any discussion? All in favor?
Aye.
No.
Any opposed? All right, Jacinda.
Just give us